Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Today my guest is Brad Martin, who's a pharmacist from Tyler in Texas, from Kinsey Pharmacy. Thank you for joining us today, Brad.
All right, thank you for having me.
So first of all, can we learn a little bit about you? What made you decide you wanted to be a pharmacist?
Well, that's an interesting question. Went to college, not really knowing what I wanted to do, and enjoyed the sciences, and was actually just playing sports through college. And then when I got out, I found myself with a biology degree, and not really sure what to do with it. So my family was in healthcare, some nurses and dentists and doctors, and so I had a good relationship with the hospital there in Fort Worth, Texas, and met with the director of pharmacy there, and he was kind enough to let me intern there and see what it was all about and find out the different paths you can take in the field of pharmacy here in the United States. So, yeah, then I went to Texas Tech University, got my doctorate of pharmacy, and then moved out here to Tyler with my wife, Amy, who's also a pharmacist.
Mm-hmm. So the LDN that you compound, what forms do you make it in?
Well, we make it in the capsules, the naltrexone, hydrochloride anhydrous. We use the instant release, and we've made it in all different strengths. Sometimes people don't tolerate the 4.5 milligrams right away, so we'll make a 1.5, and they can take 1, and then 2, and then 3, get up to the 4.5 milligrams is what we generally do. And then we have actually made it into topical creams for. We have some dermatologists that are using it for neuropathic itching. So when all else fails and they're trying to stop using so much steroids, we've actually made it topically as well.
Mm-hmm. Do you do a liquid and a sublingual?
No, we really haven't gotten into that. Just we haven't had a demand for that at this point.
Mm-hmm. Okay. And what fillers do you use in your capsules?
We use just plain sucrose. We don't use any kind of sustained release or plant-based stuff. It is just sucrose, just to fill it.
Mm-hmm. And what results would you say your patients have had so far?
Well, we've used it mainly for an adjunct therapy with a lot of our hormones, hormone patients. We've had pretty amazing success with lifestyle choices. We've had improvements in weight loss, smoking cessation. We've actually had one patient whose gambling addiction has pretty much gone away. We've had some really amazing improvements in sleep quality, even though that's sometimes adverse event is sometimes people complain about vivid dreams, but actually we've had pretty much the opposite experience. Some people do need to move their dosing to morning, but people are really impressed with the quality of sleep, and just overall their immune systems are enhanced. A lot of improvements in GI health as well.
But I mean, as you were saying, many people report to me that they've slept better on LDN than they have for years. You know, the quality of sleep has been better. You know, if you don't sleep properly, you just feel so tired during the day and don't feel as well as when you have a good night's sleep. So I think even if that was the only thing that LDN did for some people, it would still be worth taking.
Oh, absolutely. Personally, I've battled with sleep, and physicians have, you know, I've had gone through your typical sleep aids, and you wake up feeling, you may have slept, but you feel like you were unconscious as opposed to a restful sleep. The complaint of vivid dreams with LDN, I think, can often be contributed or explained by the fact that a lot of these patients haven't had REM sleep in a long time. And so you get almost a REM rebound effect when you actually do have REM sleep. Your body is so starved for REM sleep that your dreams, and you're not used to it either. So, you know, you're not used to what a REM sleep dream is. And so when you actually get it, you wake up the next morning like, what was that? You know, that was bizarre. So it's kind of like, well, that's what, you know, your sleep is supposed to be like. You know, you're supposed to have REM, you're supposed to have vivid dreams, and you're supposed to sleep well and feel rested. And so a lot of people, as time goes on, that becomes their norm, and then they say, well, that issue went away, and I think they just actually got used to having normal sleep. So it's pretty impressive from that perspective, and definitely lack of sleep is a serious health condition. We still don't have a really good handle on treating.
Mm-hmm. And as a pharmacist, have any of your patients reported any adverse effects? I'm not talking about vivid dreams or sleep disturbance, but anything else that may be different to that.
You know, I think GI problems, and again, you know, the majority of your immune system lives in your gut. Also, there are just tons of opioid receptors in your gut. You know, I think that anything that will interact with the immune system and opioid receptors will have an effect on your gut. However, you know, it's pretty much transient, and in general, people have felt an improvement in their gut health. But again, I think that's another issue of coming around to what a normal, healthy gut should be. Mm-hmm. You know, if you live your life, you know, experiencing one thing, and then that's your normal, and then things change, then obviously you do notice the difference.
So, other than the thyroid conditions that people take LDN for, you were saying before we started about skin conditions. Could you tell us a bit about that?
Yeah, so oral LDN, we've actually noticed improvements in people's skin conditions. What's interesting is people are noticing healthier hair. People who have dandruff, which is also an immune, can be related to immune dysfunction. They're finding they can go, you know, days without using a medicated shampoo where they couldn't before. Also, topically, for a neuropathic itch, where basically there's no real good reason for an itch, a topical naltrexone has actually improved that function as well. So it's, I think that the oral LDN would do it as well. I think you're removing some of the reward factors. You're not getting that dopamine release from scratching, so it's more of a neurological issue than it is a dermatological issue with that problem with the neuropathic itch. We don't know why we itch. Some patients have problems picking at themselves, picking at their skin. Low-dose naltrexone has helped with alleviate that almost addictive behavior of picking at their skin, where they get a dopamine reward. When you enhance your endogenous endorphins and enhance and upregulate your morphine or opioid receptors, basically you're kind of canceling out that reward system they had for negative behavior.
Mm-hmm. And of course, LDN works really well for psoriasis and eczema, Hailey-Hailey's disease, if you've heard of that. I was just trying to think. Alopecia, all being different skin conditions. So that's really interesting. We'll just take a quick break and we'll be right back. The LDN conference is available to everyone, regardless where you live in the world. Fast internet is required. We have an amazing lineup of LDN experts giving presentations and answering your questions. This is a unique conference not to be missed. You can join us either via the live stream at a time to suit you or in person. The presentations will be available online for 12 months, allowing you to watch as many times as you like at times to suit you. Check out www.ldn2017.com. Any questions, please email me ldn2017.linda@gmail.com. To listen to individual radio shows and interviews, go to www.mixcloud.com/LDNRT. I'll repeat that. It's www.mixcloud.com/LDNRT. Welcome back. We're now joined by family nurse practitioner Zaina Elliott. Thank you for joining us today, Zaina.
Thank you for having me.
Wonderful. So you were telling me that you have a practice in Tyler, and could you tell us what kind of patients that you treat there?
I treat patients of all ages. Mostly the patients that I'm getting here are patients who are frustrated because they feel like no one is listening to them about their whole body and the whole condition of their body, that everyone that they see is really focused on whatever their one specialty is.
Mm-hmm. And what would you say at the moment the main conditions that you see coming to you that you're treating with LDN?
Everything from hypothyroidism, especially people with Hashimoto's, as well as a number of autoimmune disorders from chronic mono or chronic Epstein-Barr virus, as well as lupus and rheumatoid arthritis. I had a lady in just this morning who I've been seeing for a while with rheumatoid arthritis that I put on LDN about a month ago. She just tapered up to 4.5 milligrams, who even just looked like a better person, with her husband asking her, what is that stuff Zaina has you on? Because she just looks and feels better.
That's amazing, isn't it? So
Yeah.
As well as having adults, have you treated many children with LDN?
I have not. I haven't treated any children yet.
Okay. So with the thyroid patients, have you noticed that they have to be very careful with their thyroid medications, with their thyroid levels changing?
Yeah, I'm finding that they're not, some of them aren't needing as much, and that I'm having to watch them closely. But because I think you have to be careful not to just pay attention to the numbers, but how they're feeling. Mm-hmm. And as they start feeling better with the LDN, if they then start having symptoms or feeling bad, to look close. Sometimes it's hard to convince people that less could be better. Everyone wants to fight decreasing thyroid, but once they do and they feel better, then it's easier.
Yes. And what about chronic pain? Have you treated any patients with that?
I have, actually. I've got like 2 or 3 patients with chronic pain, either from one that has it from an accident years ago, one that has it from arthritis, one that just has had pain forever, who are amazed at the change in their pain. Actually, it's fascinating, the change in pain with LDN. And it happens fairly quickly, within the first 10 days or so.
Mm-hmm. Are these patients, when they come to you, on opiate painkillers, or are they just on like ibuprofen or paracetamol?
My patients, most of them are not taking any hydrocodone or opiates. I have one who just started it, so I'm going to watch and see how she does. But most of my patients have been looking for ways to treat their pain that are not opiates, that are, they've been avoiding that route for a long time.
Yes. Well, that's interesting. I think from speaking to pain specialists, those people that haven't been long-term users of opiate painkillers respond quicker. I won't say better, because I think the others do, but it just takes a little bit longer for the immune system to rectify itself, if you like. I'm not a doctor, but it still works, which is amazing. And have you had any patients with chronic fatigue syndrome?
Oh yeah, absolutely. Several with chronic fatigue who feel better. I've had everything from chronic fatigue patients who feel better. I have a patient who was a young woman who smoking a lot and also had asthma that was getting a lot worse with it, and had also developed a little gambling issue, who has stopped gambling and has stopped smoking. I've just seen amazing effects on all kinds of disorders.
That's interesting, with the gambling and the smoking. I mean, did you do anything different, or just use the standard protocol?
I just used the standard protocol. Mm-hmm. And actually, to be honest, I was not targeting the gambling, and kind of didn't think about it. Her smoking was a problem because it was affecting her health so bad. And I knew, because I've known her for a long time, mentally and psychologically, I really didn't want to do anything else. Everybody thinks Chantix, and I hate that drug. And so I told her that I wanted to try this for her smoking. And then the gambling, there was no actual effort put into her to stop gambling. That was not the purpose.
Well, isn't that amazing? Because, I mean, having a gambling addiction is quite something, isn't it, in your life? And to be able to stop without having to go through any kind of withdrawal is amazing, isn't it?
And without even consciously trying is the more amazing part.
And the same with the smoking. I mean, I've never been a smoker, but I'm told it's really not very easy to give up smoking. So she's done really well, hasn't she?
Well, to me, it proves, I think smoking gets, smoking gets overplayed with the nicotine addiction aspect, because I think it's so much more about your brain and gratification and about the process of smoking, not the actual nicotine.
Yes. And with these vape machines, I tend to think that people that get off smoking and go to the vape machines then still continue with the vape machine. There doesn't seem to be an end point to the people that I've seen that actually stop completely, if that makes sense.
Right. Well, but that's what I'm saying is it's a whole different process. It's not about the nicotine. It's about the action. It's about it's a whole different process.
It's a bit like a baby having a dummy or a comforter or whatever it is you call them over there. Something in your mouth to suck on, isn't it? Yes. Yes. An adult one. Yes. So that's
right. Right. Exactly.
Yeah.
Exactly. It's an oral fixation, and we all manifest those desires in different places, that whole, just the thought that a lot of these processes are about our brain seeking actions of gratification, whether it be opiates, whether it be alcohol, whether it be smoking, whether it be food, because, naltrexone is part of a weight loss drug on the U.S. market, because it targets that, that part of the brain and that process where we're seeking gratification.
So it's really something to look out for, isn't it? And we have 3 psychologists talking at the conference in September, and 1 psychiatrist who is using LDN. He's actually done a survey for Ldn and sex addiction, and he's going to give us the results. So I'm told it works really well, but it's the same kind of thing, isn't it? An addiction, regardless what kind of an addiction, that it can work on. Yes, that's really good. And before you came on, Brad and I were talking about LDN used for skin conditions. Have you treated any yourself?
Yeah, did you tell about our one patient? We had one patient that had dandruff or seborrheic dermatitis that had the flaky scalp, and really not even using it for that to be the result, found that the symptoms essentially went away with it. But it just proves that all those things are related, all those inflammatory disorders.
And I think a lot of people go through life not, like you say, dandruff, aren't aware that it could be an autoimmune condition. It's just,
right.
Yeah.
Right.
So,
yeah. Well, it's interesting because I kind of watch everything about my patients, and so in using it initially, I started taking it, and I'm an interesting subject because I really don't have a lot of health issues. I think, I have a hypothyroidism, but that's about it. And so after taking it for about 6 weeks, I have patients I see repeatedly. I see them a lot, and after about 6 weeks, I started having patients multiple times a day commenting how great my hair looks or how great my skin looks because, they've known me for a long time. And I remember, and I told Brad it had to be the LDN because I purposely made that the only change that I made. And the quality of my hair and skin improved immensely. I mean, to the point that I would not stop taking it because I feel great, but I didn't feel terrible before. But I'm almost 50, and my hair and skin are probably the best they've been, and I don't even know how long.
That's amazing. People report back to me that their hair grows quicker and then nails as well. So have you noticed that your hair grows quicker?
I see that. Mm-hmm. Yes, absolutely. Well, and I think what it is a testimony to how inflammation affects our body because, you're really looking at the theory of the cascade of how inflammation affects us, whether it's affecting blood pressure or whether or not it's aging you. When a patient comes in and sits down, I can look on their face and I can tell that they have a lot going on because inflammation affects cellular reproduction and affects your hair. Hair falls out. People are stressed and their hair fall out. So if you're doing something that's going to help that process, then it's going to show in your skin and your hair and in your eyes. And you're going to see it, and it's just a testimony to how that LDN affects that information process.
So for people listening, if they would like to make an appointment with you, do you have a website?
I do. It's www.zanasplace, ZANASPLACE.com.
Wonderful. And what is your website address, Brad?
It's KinseysPharmacy.com. It's KINSEYSPHARMACY.com.
Wonderful. And I didn't realise when I introduced you that you're actually a PhD doctor, so I apologise for that. I wasn't aware.
That's perfectly fine.
Okay. Well, it's been amazing talking to both of you. Thank you very much, and I hope that you make it to the conference. If not, you'll have to join us online because it's live streamed, but I'm sure you would get a lot from actually coming.
All right. Thank you very much for having us.
Okay.
We're looking forward to it.
Good. Thank you very much. Bye-bye. The LDN Research Trust has its own forum, which can be found forum.ldnresearchtrust.org or via our website. The forum is divided into sections, so it's easy to navigate and find what you're looking for. You can share your experience, ask questions, keep a journal, etc. Unlike Facebook, the posts are always easy to find and don't get buried. We have a private medical professionals only section. To find out more, please email me, linda@ldnrt.org. The LDN conference is available to everyone, regardless where you live in the world. Fast internet is required. We have an amazing lineup of LDN experts giving presentations and answering your questions. This is a unique conference not to be missed. You can join us either via the live stream at a time to suit you or in person. The presentations will be available online for 12 months, allowing you to watch as many times as you like at times to suit you. Check out www.ldn2017.com. Any questions, please email me, ldn2017.linda@gmail.com. This show is sponsored by Dixon's Chemist, who are the experts in LDN and associated treatments in the UK. Dixon's Chemist are the most cost-effective for LDN in all forms within the UK and Europe, maintaining safety standards far in excess of what is required. Why would you choose to get your LDN from anywhere else? Call 0141 404 6545 today to speak to their LDN experts. Any questions or comments you may have, please email me, Linda, Linda, @ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.